Hi, and welcome to a special live edition of Our Mental Health, a community collaboration webcast series. I'm Leslie McDonald. What's on your mind? We're over a year into this pandemic and the vaccine rollout is progressing well. Hospital rates are down. There's a buzz in the air as the weather heats up and people are starting to come out of their cocoons. But this pandemic is far from over. In this global environment, variants are still a threat, and the only certainty that we have still is uncertainty. Our Mental Health 1 Year In is a three-part series that takes the pulse of the community with this pandemic. Last month, we brought you a big picture perspective in year one. That's where we interviewed some of our most senior members of our community about what they're seeing within their own organizations and what they're seeing with the people they serve. And next month, in part 3, we're going to look at innovations that are coming out of this pandemic, both locally and internationally. But today, we want to hear from you. We want to know if you have any questions. We want to know your observations. We want to hear your concerns. And we have brought together a pretty fantastic, very diverse panel of experts who are going to answer those questions and comment. So you'll get to hear what you want to hear. A little background. Our Mental Health started 4 years ago as a lecture series presented by CASA Child, Adolescent and Family Mental Health. And when the pandemic hit, we went online. Our Mental Health is now a collaboration. In partnership with CASA are Yes, Youth Empowerment and Support Services, the Glenrose Rehabilitation Hospital Foundation, and Kickstand, a new youth health initiative. We'll be collaborating with other organizations as well to bring their expertise to each webcast. And today that includes Alberta Health, the University of Alberta, and the Institute for Sexual Minority Studies and Services. And our ongoing media supporter is Global Television. Our goal always is to bring you reliable, accurate information to inspire conversation, hope, and wisdom. Well, it's time now for you to get out a pen and paper, or if you want to go a little bit more tech, take a screenshot, because we want you to participate in today's discussions. We want your comments, your questions, your concerns, and you can text us at 780-919-9032, or you can send us an email if you prefer. That's at webmaster@casaservices.org. Just let us know who you are, like maybe a first name and the city you're in, and perhaps who you'd like to address your questions to or comments to on the panel. And we're going to read out your questions to our panel members. I'm really excited now to introduce you to our panel. I'm going to ask each one of them a few questions before we move on to the next person. And we're going to begin today with Dr. Vincent Agyapong. He is clinical professor and director of community psychiatry at the University of Alberta. He is also the Alberta Services Clinical Section Chief for the Community Mental Health Edmonton Zone. In addition, Mr. Agyapong, Dr. Agyapong, or Vincent, I think I'll call you from now on, is the lead psychiatrist for the innovative Access 24/7 program, the creator of the internationally recognized Text for Mood program, and the lead researcher for a 5-year study on the mental health impact of the Fort McMurray wildfires. Vincent holds 2 doctorate degrees in psychiatry and global mental health. He has over 100 publications in international peer-reviewed journals, and he's presented at over 65 national and international conferences in 18 countries. His research focuses primarily on health innovations that expand access to quality mental health care. Vincent's been recognized with several awards for excellence and innovation for his work, for his compassion, and for being a champion of mental health. And I am so delighted to have you here with us today. Thank you so much, Vincent.
Thank you very much, Leslie.
So where I want to begin, one of the common themes that I've been hearing since we first began, like 4 years ago, is how challenging it is to maneuver within the system. The system is so hard to work through, to get this access to services that people need. And that's why, when I heard about your Access 27, so innovative, but most people don't know about it. So you can tell us a bit about what Access 24/7 is.
So Access 24/7 is a one-stop shop for all access to our addiction and mental health programs within the Edmonton zone. It's by very dedicated mental health therapists, managers, and physicians. So it runs 24/7, 7 days a week. We have mental health therapists throughout the night, and we have psychiatrists that run an urgent psychiatric clinic from 8 a.m. to 8 p.m. 7 days a week as well. So it's a place where referrals are received. People can walk in, family doctors can phone in for advice, and really with the creation of the Access 24/7, there should be no more challenges with people gaining access to our addiction and mental health programs.
Yeah, and how do they access? So how do you find out about it? How do you know where to go?
So Access 24/7 has multiple routes of entry. You can actually physically walk in to our facility, which is located at the Royal Alexandra Hospital campus. Yeah. Your family doctor can refer you via a letter. You can actually phone from home, or you can phone on behalf of any family member of yours. You can be referred by any community or service provider. So it's not just family doctors that can refer you to Access 24/7 program. Anybody can walk in, phone, or be referred by anybody at all.
And you don't do any advertising about this, so it's really just by word of mouth?
Well, I think there's been a lot of advertisement when the program was launched, and there's ongoing advertisement. It's got a visible presence on the AHS website, and there was communication sent to all primary care providers. There's ongoing and continuing engagement. Prior to the establishment of the Access 24/7, there was a lot of engagement with, from AHS leadership with various community stakeholders. There was their input into the very creation of the program. But I do agree with you, there are still some people that have not heard about it, and definitely programs like this are, I think, a great way of disseminating information about the program.
And something too that really is part of what we should be looking for in the future for all services, to make it easier for people to access.
Absolutely.
Yeah. I just before I move on, I want to talk to you about your Text for Hope program, because you have developed things that really make things accessible for people. How does the Text for Hope program work?
So anybody can subscribe to the Text for Hope program by simply texting the word COVID-19 Hope all together to 393939. Immediately they are enrolled onto the program to receive 3 months of daily supportive text messages, which have been crafted by addiction and mental health therapists in collaboration with service users and psychiatrists. So these messages have been crafted specifically to target anxiety, depression, suicidal ideation, stress, and post-traumatic stress disorder. After the 3 months, you can then enroll on the Text for Mood program if you want additional messages. Yeah. It gives you 6 extra months of free daily supported text messages.
There's so many things to talk to you about. We're going to have to continue in our group discussion. Thank you so much. I'm going to move on now to our next panelist, Dr. Suzette Bremault-Phillips. I hope I said that right. Thank you so much. She is an occupational therapist, and she is associate professor in the Faculty of Rehabilitation Medicine at the University of Alberta. She's also a research affiliate with the Glenrose Rehabilitation Hospital, and director of the Heroes in Mind Advocacy and Research Consortium, which I've heard a lot about. Consortium, a provincial hub for research, teaching, and service for the military, for veterans, public safety personnel, and for their families. Dr. Bremault-Phillips is a clinical scientist and published researcher. Her areas of expertise include PTSD, moral injury, trauma-focused and supported psychotherapies, system capacity building and resilience, just to name a few. Welcome. I'm so delighted to have you here, Suzette. You and I had a great conversation. You're involved in so many exciting projects.
It's true, many of them.
Oh, there's so much to talk to you about. But what I want to ask you about is this whole concept of moral injury, because this is a term we haven't heard a lot about, but we're going to be hearing a lot more about. And from what I understand from what you told me, it's based on the idea that our healthcare system has become a war zone.
I think, many of our healthcare providers, myself being one, not currently in clinical practice, but certainly resonating with those who are on the front lines of dealing with COVID-19. And many of them have signed up to care for people and have really been put into an unprecedented situation in terms of dealing with the magnitude of suffering and struggle and death, as they've been trying to support those who are going through the experience of COVID-19 and who need exceptional care, and who might not have the support, the immediate support anyway, of their family and loved ones around them, and having to really be witness to so much struggle, so much suffering. And the fallout of that can leave people in spots of distress and struggle. And as they hold their breath, many of them trying to deal with such an unprecedented, as I said, situation. So many of them can go through, that profound commitment that they have to serve and care and provide, extend this compassion on behalf of all of us, especially when we as family members aren't able to be with our loved ones in those times. And so they're the people who are on the front lines, caring and loving and doing those things that we need them to do. To take care of all of us and our loved ones. And unfortunately, that sometimes comes with bearing the weight of struggle and human pain and suffering, and not necessarily, and also being put in these situations where they might have to make some difficult situations or bear witness to things that might be more difficult for them to witness or see, that can leave them in these spots of struggle and grief and pain, where they might also feel compromised, feel like they've been let down, or that they haven't been able to do things in the way that they would like to, with the quality and compassion that they would like to, just because of the nature of the situation. So these situations that they can find themselves in, being overburdened, and so we use the term moral injury. Moral injury came out of the was coined out of the military context, where people were on the front lines and dealing with situations where they bore witness to things that really clashed with what their values were, watching human suffering or struggle, or sometimes the horrible things that can happen that can be shown one to another in those kinds of contexts. And in these times of COVID-19, where we have people having to make life and death decisions and maybe witnessing things, or being put into situations, or having to put others that they care for or under their charge into those kinds of situations where they're at risk, putting people at risk, being at risk, bringing things home to their families that may put their families at risk. All those things can cause this tremendous amount of struggle and challenge. And those things can sometimes, depending on how they're handled and depending on how they affect people, can leave people with some grief or some loss that there's no time to process. There's no time, the demands are so great, and they're holding their breath while they're doing it. So I think that there can be this residual suffering and struggle that they carry on behalf of all of us, and then they carry their own struggle personally and professionally as they've been dealing with so many. And that will have, for some, it'll be a struggle. For some, there will be some unresolved griefs. For some, they'll be able to manage it, and everyone will deal with it in a different way. All of us as civilians will deal with it in a different way. But there can be these things of growth and resilience that come out of this as people work through the challenges and struggles, but also see the moments of joy and people coming together to care for one another. And those are the spots of us working with each other to support as a community one another as we go through this normal experience in an abnormal situation of human struggle and pain, and come out on the other side, hopefully all the stronger for it.
Yeah, well, that's part of what all of this discussion is about, to help people look at things in a different way as well, and know that they're not alone, and to build that whole community. So
Absolutely.
Thank you, Suzette. We're going to come back to you a little bit later with our panel. Joining us as part of our panel today as well is a trauma therapist at Youth Empowerment and Support Services. Marcia East has a master's degree in counseling and social work with over 20 years of experience working with youth and their families. 15 of those years were spent working with children, youth, and parents in her home country of Jamaica before coming to Yes Trauma Care team to work with homeless youth. Working with diverse populations has helped Marcia to cultivate a multicultural approach to serving youth from different backgrounds. Welcome, Marcia. So pleased to have you here as well. You have seen a lot working with youth who were already struggling before this pandemic. But one of the things you told me that kind of surprised me is you said a lot of youth now you're starting to see have PTSD. What's that about?
Yes, that is right, Leslie. Most of the youth that we deal with at our shelter have experienced trauma in some way. Some have experienced multiple trauma in their lives. And because of that, we are seeing youth having PTSD. It is quite prevalent. It is also, PTSD is debilitating in youth because generally youth's brains are not developed as well as adults' brains are. And so this reduces their capacity for coping with trauma and its impact. Also, it is common for youth to feel that they are unable to escape the experiences which are associated with the trauma. Because of their state of development, they may not also have the required coping skills to deal with the trauma that they are experiencing. During this pandemic, I've seen youth who are being re-triggered. Their traumas are being re-triggered because of what they are presently experiencing, the loss of control. They're feeling powerless. It's bringing back their anxiety, fear. There is a real fear of death right now, and that is also affecting our youth. They feel unsafe, which is triggering past trauma. Mental health for our youth has also declined during this pandemic. We see drug use dependency has worsened, and youth are experiencing boredom with little or nothing to do during isolation. They're losing interest in school and studies. Some are struggling with anxiety and depression. Some of the symptoms that we see are nightmares, trouble sleeping. They're avoiding situations that remind them of traumatic events that they have experienced. They have flashbacks about the trauma they have experienced. They are hypervigilant, they're hyperaroused. Also, sometimes the symptoms are accompanied by anxiety, depression, and substance use. And it is very difficult for youth to express what they are feeling sometimes, and they may not also know how to ask for help.
Wow. You know, one of the things that you said in those comments that kind of took me a little back is fear of death. What's that about?
Yes, youth have expressed that they don't know when they're going to die. They may die anytime. Many of them have lost friends, loved ones during the pandemic. And so it has become very real for them. Death is something they think that can happen at any time. And it feeds into the hopelessness that they feel sometimes, which brings on anxiety for the future.
Wow, that's very stressful. That would be stressful for anyone. Anyway, we'll look forward to speaking more to you in the panel discussion. Thanks so much, Marcia. Our next panelist is someone we've turned to a lot for insight during this pandemic. Candace Fair is a social worker and a parent with lived experiences of Alberta's child and youth mental health systemic care interventions. As co-chair of the CASA Family Advisory Council, she is a strong mental health advocate for families, committed to increasing community knowledge, tolerance, and compassion. She's also a director of the nonprofit organization Bikers Helping Kids, a charitable motorcycle group whose purpose is to empower abused children and help parents navigate the child welfare system. Candace believes that community has the capacity to create change. Thanks so much for being with us again, Candace. One of the, when we first started talking about this pandemic, especially, there was a lot of talk about you got to have a positive attitude and all the things that you can, and things have kind of turned. There's something to be aware of. Is something called toxic positivity. Can you talk a bit about that?
Thank you, Leslie. Always a pleasure. And I just have to first start by saying that I'm so excited to spend some time with the panelists here today. Already the introductions have me bouncing in my seat. I can't wait to see where our conversations go. But yeah, the whole concept of toxic positivity, just a little bit of a backstory there with respects to my social work and family support and community. When COVID hit, a year and some ago, immediately I started getting calls from families who were expressing concern about, where to go, what direction, this whole concept of homeschooling, etc. And the feedback that they were getting and what they were reporting to me was frustrating for them. So if we recall in the beginning, there was this feedback circulating in and amongst community about, get a book, do a puzzle with your family, find some time to do a craft. I can tell you that was the last thing on anybody's mind, at least the families that I was supporting. And so this concept of toxic positivity is really about just stretching ourselves as community helpers, as community nurturers, to understand that, it doesn't have to always be good vibes only. We really want to be able to sit with families, youth, children in the moment and be able to validate and help them organize emotions and feelings. And, not necessarily does that always mean you put a positive spin or there's sunshine and rainbows involved with that. Sometimes it's just about sitting in the suck, Leslie, just stay there for a bit.
How do you know what to do? Because sometimes, someone's going through something tough. How do you know, how far to go or how to support people without sort of getting down with them?
That's a wonderful question. Recently, just actually this week, ironic that you would ask that, I took some training with some fellow trauma-informed collaborates, and one of the cohorts on the virtual training that I was with said, you know what, guys, it's about this. It's about observing, not absorbing. And so as community helpers, right, if we can get to a place where we can learn to observe and validate again, have compassion, increase our empathy, I believe we can, help each other out now more than ever, because you've already mentioned, Leslie, this concept of leaning on community. And I just want to quickly go back to the nonprofit organization that I'm a part of with Bikers Helping Kids, and just really quickly correct you just a bit in terms of what our organization is about. Quite honestly, is about increasing tolerance and empathy in our community for youth and their families who struggle with the effects of mental health challenges. And we're going to do that by training and advocacy. So really, this concept and this word again that I've heard over and over about trauma, that is the focus for us, is raising a more trauma-informed community. Thank you.
Wow. Thank you. One of the things, Candace, that you've heard me say over and over again is not about you. So that's a good way to be a listener. Thank you so much. We'll come back to you later. Next on our panel is Alex San Diego. She is the Youth and Family Engagement Coordinator for Kickstand, working to transform how young people in Alberta access health and wellness services. She's also a Filipino-Canadian, a mental health advocate, and volunteers as Chief Marketing Officer for the Asian Mental Health Collective. Alex has her own lived experience with depression and anxiety. As a mental health advocate, she uses the tools of public speaking, social media, and communication to share her story, to create, and to provide resources. So Alex, welcome. And I want to mention there's this, something that that we've been hearing a lot about is all this backlash against the Asian community since the pandemic began. It's not the first time that the Asian community has faced backlash for various things, but it's having a real impact on the youth in the Asian community. Can you talk about that?
Absolutely. So, as reported quite widely in the media, racism towards the Asian community has been on a rapid rise since the outbreak of COVID-19. Fight COVID Racism, a Canadian project, has actually reported over 1,000 racist incidents in the country to date. And though some folks may feel like it's just words, these experiences can be quite traumatic, especially considering the overexposure to these experiences in the media. And Canadian researchers have actually found that Asian Canadians reported poor mental health correlating strongly with these feelings of discrimination. And not only does it impact our mental and physical health, it actually creates systemic barriers that prevent us from accessing health services. And in terms of the young people that we work with in Kickstand, we have heard from them that they want trauma-informed support and that they want culturally relevant resources as well as a result of these traumatic experiences.
When you talk about trauma-informed support, can you elaborate on that?
Absolutely. So oftentimes when folks think of trauma-informed support or youth that need trauma-informed support, I suppose, they might not consider young people who are experiencing racial trauma. They might be considering young people who have been street entrenched or have experienced really acute mental illness and addictions. But there are other types of trauma out there, for example, racial discrimination. And there is, I guess, a certain type of mental health support that these racialized young people need in order to heal from this type of trauma.
Thank you so much. We'll come back because I want to talk about youth a little bit later as well, more about
Absolutely.
youth. Our next panelist is a psychiatrist and the addiction medical lead for the Alberta Health Services in the Edmonton zone. Dr. Mohit Singh is a Doctor of Medicine degree from the University of British Columbia and a fellowship training in addiction medicine from St. Paul's Hospital, BC Centre for Excellence in HIV/AIDS. He also has a forensic psychology fellowship, psychiatry, I apologize, Mohit, fellowship from Yale University. Mohit's practice includes the Opioid Dependency Program, ARCH Program, Addiction Services Edmonton, and the Drug Treatment Court. Welcome. You know, when I was on my way to this today, they were talking about this huge spike in opioid deaths that's happening right now. And we know that there is an increase in addiction and substance abuse. But wow, it's getting scary, Mohit.
Yeah, Leslie, thanks so much. First, thanks for having me, and it's great to be surrounded by yourself and all these panelists. And looking forward to the discussion today. I think the opiate crisis is a real challenge for families and communities in the Edmonton zone, but all throughout Alberta and parts of Canada. And I think that sometimes we fall into this fallacy of thinking that addiction affects some people but not others. But I think it's really a challenge we have to address together. Because I don't think anyone makes the choice to use alone. We're seeing a lot of the overdoses and the spike that you're talking about in people's homes, where people are overdosing. And I think as much as we've talked about substance use and treatment, that stigma is still real for people wanting to know where they can reach out, where it's safe for them to reach out for help. And so I really appreciate that question and opportunity to discuss this further today.
I think the scary thing about the whole opioid thing, Mohit, is that these are not people who got addicted at a young age. These are not people you would expect to have a drug addiction.
Yeah, that, I think that's a really great point. There's not one specific type of individual or group of people that you can look at and say like, hey, yes, that, that's who's going to have an opiate use disorder or an opiate addiction. I think we have to remember that we have to make supports available and ask people, like take the time to actually, ask them if this is a concern for them so that we can appropriately address it.
So what is considered to be, if you have a problem? How do you know if you have a problem? Like my husband and I became aware of the fact that we're going through a bottle of wine a night. We're really enjoying it, but I think it's time to look at that. And we're not alone. I mean, a lot of people are going through that. So how do you know when this becomes a real issue?
Yeah, and look, I think that, there's different things that are accepted by our society, alcohol, for instance, and I think the real point is that if you feel like there is a concern, that it's okay to bring that up. That itself is a good question to ask. A counselor, a social worker, a physician. Talking to your friends and family about that. If you're feeling like, hey, maybe this is impacting, my mood or my day-to-day functioning, it's important to bring that up.
Mm-hmm. Or maybe, I guess, it becomes an addiction when you can't stop it.
And I think, I think what defines that addiction, what we look at least, is different for different people. But when it starts to negatively impact your functioning, whether that's with your friends, family, your work obligations, or your own goals, I think that's when you're touching on maybe this being a challenge.
Such an important topic right now. Thank you.
Our
next panelist is Beverly Keeshig-Soonias. She's a registered psychologist with a law degree, and she has a law degree and a master's in family therapist. She's an Indigenous woman living in the traditional territory of the Cree, Blackfoot, Saulteaux, and Métis nations. Beverly has worked interculturally as a psychologist, specifically with adolescents and families, since 1992. She has extensive knowledge of the intergenerational and systemic effects of residential school experience, family systems, adolescence, addictions, and the power of healing. She provides support for healing from all forms of unresolved trauma, including intergenerational, multi-generational, and Indigenous complex trauma. She serves as the Indigenous Elder on the executive of the Canadian Psychology Association. Beverly is a mother, a grandmother, a great-grandmother, as well as Kokum to many children and youth. Welcome, Beverly. You told me that you were retired. You had retired when the pandemic hit. You decided to come out of retirement. Why?
I think it was because it was partially a cultural, moral pull to look after the younger people, to look after the community at this time. And it's always been done in a very relational way. And so because of my age and because of some of the academic background and lived experience, I thought I could help out at this time. And as everyone has mentioned, there's an increasing need for support, mental health support at this time.
Yeah, and very few people like you. Very few people with your kind of background and your expertise.
Oh, yeah. When I graduated, you could fit us all in a phone booth when there were phone booths. There weren't that many Indigenous practitioners at the time.
Yeah. What are some of the, exceptional experiences that the Indigenous people are facing during this pandemic that you're seeing as having a real impact on the mental health in that community?
Well, I think everything that everyone else has pointed out as being part of a larger society, being a resident in this province, the word trauma has been used, and so that is an experience, a collective experience for people. But on top of that, there's always superimposed our very unique position in Canada. We're the only one of this group that are legislated by a piece of legislation because of our race, and we're the only ones in the group who have a history of being an apartheid history. So many of us are still living in communities where we didn't have permission to leave until quite recently. Many of us have never participated in the political system or the health system because we couldn't vote till the 60s, and we have no access to health, and the infrastructure doesn't support.
I can see someone beckoning you in the background.
One of the things I was saying about the infrastructure is even trying to have access to health information or health services. A lot of teletherapy is being used. And so in many communities, there's no access even to internet services, in any kind of substantial way. So just proof of that, as I was waiting for you, I completely lost my internet connection, had to run into the kitchen and find another machine that would allow me to speak to you. Wow. So thank you for waiting for me, Leslie.
One of the things that's interesting is that you treat Indigenous and non-Indigenous people. So you have a really unique perspective. What are you seeing during this pandemic? What can you share with us?
Well, first of all, I do work cross-culturally, like you said, but people assume they're working with others, that idea, I'm working with others when I work cross-culturally. But to me, it is, learning everything I can about Euro-Canadian society and all of the institutions and the family system, for instance, and even the history of how mental health is considered from a Euro-Canadian perspective. Some German dude in Germany decided to come up with, psychology. And so it's been interesting that way. But I've also got, as part of my background, all of these strength-based approaches to health and to healthy communities. And so in a way, it's very wonderful. It doesn't exactly translate into equity as far as health for Indigenous people, but it's wonderful to have all these resources when I'm working with Indigenous youth and children, people in the LGBTQ plus community, because our language is non-binary. It gives me that freedom to work with youth and not spend a lot of time stumbling over, pronouns in English. And so.
Your beautiful spirit just comes right through the screen.
Thank you.
Thank you. We're gonna continue our discussion shortly. Our final panelist is Wieness. He has 30 years of experience in community social services, working with queer and trans youth as well as emerging adult communities. Corey is now the Outreach Director of the Youth Crisis Shelter at the Institute for Sexual Minority Studies and Services, a nonprofit organization and research institute, and it's housed at the University of Alberta Faculty of Education. They provide educational programs and services to support the 2S LGBTQ+ community ages 14 to 29. He's known as the Gay Yoda, and Corey takes an outside-the-box kind of approach to mental health to help youth find hope and well-being. And thank you so much for being on this panel, Corey.
Good to be here, Leslie. Thank you. Good to see you.
Yeah, and you know what? I'm just dying to hear more about your center, like who goes, what you do, how you serve people.
For sure. So the center's been around for about 2 years now. We had a small, tiny little office before then, but the youth have had a big say in creating the center. So the idea came from the youth. I went and asked them, I said, what do you need? Like, what sort of things can we put together as a community to help you? And then the center here was born. And so it's a drop-in center. People, youth and young adults can come in, they can get basic needs, they can shower, do laundry. There's always food, there's always junk food. Try and get the healthy stuff in there too. They can play video games, they can sleep, and those sorts of things. Just giving people basic needs, but also creating that sense of community. A lot of our folk don't have a community. They're out on the street at night, or they're isolating at home. And so we try to create a family in the center. And so when you come in, it's like coming into someone's house a lot of times. The youth are playing board games, or they're just giggling and having fun. And it's created to inspire that hope. but also to create that sense of family for folk that don't have that.
What are you finding you've had success with this whole sector? Like, what have you done that's helped? Because you've been at this for quite a while, Corey.
Yeah,
And,
yeah. And I think it's because we've learned to just see people. So we don't see necessarily the substance use. We don't see the mental health piece. We just see that person that's right in front of us and what they need. And we've learned to kind of bring out those moments of hope and laughter and things that are good that we tend to forget about because we get really focused on the negative stuff. Yeah. Our folk have a lot of intersections with mental health and racism and homophobia and transphobia. There's so much negativity in their lives. It's sometimes good just to laugh or just to get together and hang out with people that understand you, or just to come in and be yourself. You're trans or two-spirit. You know, we have a whole center inside our space that's designed for you to explore your identity and your orientation and your gender. And it's beautiful where people can come in and just be themselves, no matter who they are or where they're at.
Wow, that's good advice for anyone.
Yeah, it's just to let yourself be sometimes, right?
Yeah.
And so.
Is that particularly tough with LGBTQ, just because often stand out more?
It is. Our population in particular is very invisible. Like quite often people don't see these folk out on the street. They don't, they don't know that they're homeless or that they're in trouble or they're substance users or have mental health issues. And so even when I talk about it within our community, a lot of people don't know we have a real problem with homeless youth that identify as a gender and sexual minority diversity in some way. And so, that isolation with those folks is there. And so when we create that sense of community and family, that's what has a huge impact for them, for sure.
Well, that's a common theme with all of our panelists. So I want to welcome everyone now, the entire group of panelists to this. And we now want to hear from the audience. You've heard enough of my questions. We want to hear your questions and your comments and your concerns. Again, you can text us at 780-919-9032 or send us an email at webmaster@casaservices.org. I'm now going to call on Nadine Cemisia. She is the executive director of the CASA Foundation, and she's been monitoring all of our feeds, and she's going to have your questions to present to the panel. So I'm going to throw things over to you now, Nadine.
Thank you, Leslie, and welcome everybody. I thought today we would start with a comment from Deb in Edmonton. So Deb states, one of the positives to come out of COVID-19 is that we are freely discussing mental health and mental challenges. We have all at one point or another struggled throughout this pandemic, and I love that we were engaged in discussions, presentations, and seeking to help each other, the best side of humanity. I thought that was a great way to start off our session right now, Leslie.
It is. And Nadine, we were talking about how when we first started this whole series as a lecture series, the whole idea is how can we battle stigma? What can we do about the stigma around mental health? And no one was talking about it. No one was talking about LGBTQ or anything. People were suffering in silence. So that's why we started this. So generally for the panel, why is talk important? Do you think talk is important? Is talk enough? Who wants to start? Yes.
Can I start?
Yes, please, Beverly. Yeah.
Yeah, I know that in our culture, storying is so important. Storying to figure out who you are, how you are in relation to other people, to the world, to the creator, and talk is how you bring that out. You bring out that story. And like someone said earlier, a person doesn't have to answer, or someone doesn't have to jump in and be solution focused, if you will, about it. They can just let that person express what's in their spirit. And it's a great time. I've had many conversations. The news over the last weekend has been very difficult for my community. Mm-hmm. And a lot of people have needed to speak. And if you're living in an urban center, for instance, you can't speak to your neighbor necessarily because they haven't had that experience. And it's intergenerational. It's in that context. And and it's in many layers of context being an Indigenous person. So it is wonderful that people have permission to speak. Yes.
And Beverly, you know, just in case no one knows what you're talking about and they're hiding under a rock, we're talking about the graves that have been found of children in BC, Indigenous children. Does anybody else want to comment on yeah, hi, Corey.
There we go. So the other thing that is really important is now that we have these conversations, it's important to start doing some action with things as well. You know, I always say if we're walking down the street and someone that's maybe talking to themselves or, you know, having a moment, it's okay to say hi. It's okay to smile. It's okay to acknowledge. If they say good morning to you, acknowledge that. That's creating that sense of hope and well-being that people really need so they don't feel alone. But we're often so scared of that, to do that. But it just takes a simple gesture, you know, can wave or say hello. Or if you have time, engage them a little bit, what you feel comfortable with. But we're all human beings and we tend to forget that sometimes. And so in that talking, we got to remember we're all human beings on this island, right? So it's important to just create a little hope there.
Those are wonderful comments. Go ahead.
I wanted to jump in and just say I think this is a really important point, and I think also it's important who's doing the talking, right? And I think it's really important to engage with you know, community leaders and people that can reach out to those that are maybe struggling with mental health and other issues, and because you know, when you trust someone, you're more likely to really you know, listen to that conversation. Is more likely to hit home. And you know, I work in the opiate dependency program, and you know, every day there's a conversation about, well, you know, I'm not sure about this medication because you know, my friend had told me not to try it, or I've had a, you know, they had a negative experience. And you know, I think that can be really powerful. Like Beverly talked about, you know, we respond to stories, and I think empowering people that are leaders for different communities to have those types of conversations and educate others is an important part of that.
Good. Anyone else before we move on? Yeah.
I just wanted to add on. I appreciate what Mo said about the action part of it. You know, also another thing that has happened in the Indigenous community is that the government's action plan about the missing and murdered Indigenous women, the respond to the report, well, it's a longer title, has come out, but it's called an action plan, but all of the people who are waiting with bated breath, family members who are grieving and needed something to happen, like Mo said, we're told nothing till October. So the action piece is very important also. Yes. Thank you.
Candace?
I was just going to jump in, Leslie, and just say that, you know, that comment from Deb with respects to COVID opening up conversations. I absolutely validate that, but the conversations were important before COVID. And so as, you know, in my role as co-chair at the Family Advisory Council, CASA, these are conversations we've been having as caregivers and as parents for the last, you know, 6-7 years. So what's super exciting is now we have a collaboration of, you know, individuals from not only families and caregiver background, but service providers and community members. And we're finding through talking that we're normalizing mental health, right? We're having all these conversations. So even this morning or today, when introductions occurred and Suzette was talking about military families, et cetera, or frontline responders even, you know, for me and my lens is always about, well, they have families. They go back and they manage with their complexities too. So, you know, the added challenges of COVID are just that, added challenges, but the complexities of navigating our systemic care and getting adequate and timely interventions, you know, that's what's important. And if we can keep talking about that in community, then again, we start to normalize. Because I'm no different than the military family. I'm no different than the doctor family. I'm no different than, right? We're in this together. And it sounds cliche, but COVID has literally made it. We are in this together.
Kind of about time, isn't it, Candace? Alex, we're talking about your area here, something I know you're really passionate about.
Yeah, in terms of story sharing, definitely see that in both my role at Kickstand and at EMHC. Oftentimes, the stories that we see about mental health in the media are quite stigmatized or quite negative, or don't really focus on young people, or with my work with the EMHC on Asian stories of mental health. And so, as other folks mentioned, story sharing is really that first step to destigmatizing mental health amongst these, kind of these populations that don't often get an opportunity to raise their voice, and is kind of that potential first, door to accessing the care that they deserve. And if the services that they need and want aren't there, then they can also move into the advocacy space, and take those actions in order to improve the services that are out there.
Thank you. Suzette, I've been thinking about you in this as well, because all the work you do with military and their families and veterans, how important is that communication? Because they tend to be suck it up. I was going to add princess, but not necessarily in this case.
I think that within the population that I have the privilege of serving, as well as within all of the communities that Candace is, and everybody has so eloquently spoken about, the importance of speaking, especially if people have not been used to speaking, those who have been told to hold it back and suck it up and keep soldiering on, whatever that looks like, soldiering on in our families, soldiering on in communities, and sometimes doing it alone, sometimes doing it together, soldiering on. The importance of hearing voice, of giving voice and being validated and having that shared common experience to be able to individually claim it and be validated, which is so important for our own mental health personally, but also to be able to do it collectively, and then to move from that, as already has been eloquently said, to move from that into action and being able to make change. But without giving voice to it, it's almost as though we contain it within ourselves and are almost immobilized. But when we actually give it voice, all of a sudden we can do something collectively with compassion, with confidence, with strength, and with courage together, and with hope, and with and turning some of the struggle that we've had, which often comes from those deep places of having been through so much pain. I think about what Beverly has mentioned, and how much pain and struggle and suffering and has been there, but how much that's been mobilized to be able to advocate for change going forward. So I think that storying, as Beverly said and others have talked about, Alex, just being able to name that, to move forward, to give voice with compassion, to walk with gratitude with one another. So profoundly important. Voice, speaking to help us individually, collectively make a difference.
And to be able to understand other perspectives as well.
Absolutely.
It's huge.
Yeah.
We've never done as much. I think, Vincent, you want to add a comment.
Yeah, just share some perspectives we found with our Fort McMurray wildfire studies. We found after 6 months of the wildfire, those who reported they had absolute support from family, friends, the community, were about 8 to 12 times less likely to report symptoms of major depressive disorder and PTSD. We also looked at material things like financial support from the Red Cross, insurance companies, government of Alberta gave some handouts, and they made absolutely no difference. So that's where you see the connection or relationship between communication between members of the family and its ability to be able to protect psychological well-being after traumatic events.
Mm-hmm. So maybe that's your next project, Vincent. You're so good at this, to create that kind of forum that people can participate in for mental health, because something like that is very much needed. Marcia, did you want to add something before we move on?
Okay. I've noticed that when clients are talking, when they are voicing what they feel and what they think, how sometimes just listening to what they themselves are expressing, you can see a visible change come on them when they receive some insight just from expressing, or a perspective shifting just from talking and listening and being able to express and being heard. So even from a personal growth standpoint, talking is really, really a powerful tool.
Wonderful. Nadine, you want to pick it up with our next question?
Sure. This one is from Robin in Edmonton. Do you think the way you deliver mental health services will be affected long-term, post-pandemic?
Who wants to answer? Any one of you could. Suzette?
Sure, happily. I think that the way that I think that there's some tremendous gains that have been made over the last decades in terms of how mental health is delivered and the sensitivity that people have to a trauma-informed approach. I think, to Candace's point, that much more work needs to be done in that way, and to Vincent's point that there are efforts that have been made to try and enhance that in so many different ways. Lots more work to be done. And I think that we'll continue to find and evolve new evidence-based approaches to be able to deal with mental health and support individuals going forward. I think we really need to be careful, though, about making sure that some of the approaches are evidence-informed, evidence-based, and that we don't cause undue harm, even out of the goodness of our hearts, trying new interventions that sometimes don't work. And so I think we need to do it in a very balanced way and an informed way, so that we're doing things that are helpful and not inadvertently potentially harmful, out of the goodness that we may choose to move. So I think we're evolving, and much more to learn about the way that we work. Mental health happens, that growth occurs. I think we're moving into a time of lots of potential and possibility. I really love what Vincent's been doing. I think we have new things that are coming up with social connection. I think that one of the silver linings of COVID is we're able to do this right now, connecting on connecting in this platform where we're more connected in some ways. As a result, the digital health world has opened us up to be able to connect in ways that we might not have thought to do before. So I think.
I'm sorry. I thought you were finished. Continue.
No, it's fine.
There was just something you mentioned that really, you said, concerns about, sounds like you had some concerns about some of the therapies that are being used. That did you have anything particular in mind? Is there anything that we should be looking for?
I think just there are some therapies, some interventions that have more or less evidence to them, and I don't want to go into a lot of the scientific kind of components, but I think that we just need to be mindful that not all of the interventions that are offered by people who have the credentials to be able to offer those services. I think we need to be careful that we're leaning into people who have the right training to be able to deliver the services, and that they're using the interventions that are helpful or that have been time tested. I know that not every intervention we have has gone through scientific rigor, and that's not what I'm meaning, but that we need to make sure that what we're offering is helpful and isn't causing harm. I have been witness to some interventions that can cause harm, and have had to help people put themselves back together again, and that's unfortunate when that happens. And so I think we just need to be making sure that we're looking, and I'd be curious to hear what other people think of that as well, because it's I think we all want to help others do well and to find hope, and but we have to do it carefully.
Alex?
Yeah, I think something that comes to mind for sure, just as I guess a former young person, I've aged out of some youth programs now, is that what Suzette spoke to really resonated with me, and trying to access like traditional mental health services like that are Euro-Canadian, as Beverly mentioned, and finding that it really didn't speak to my cultural background or my experiences with my family and my community, and coming out of those experiences feeling more traumatized rather than actually getting the support that I needed. And so I think through COVID, we've been having so many conversations around, again, the different types of traumas, whether it's related to, your racial identity or your gender or sexual identity. And I think because of that, like, we can come out of the pandemic with mental health supports for young people that are more tailored to what they really need, that are conscious of their identities, which are so important to them. And so that's kind of what I hope to see. And well, I know that everyone at this table is poised and ready for that. So,
Beverly?
As some mention has been made of emotional safety, and that, like Alex said, so much of that is where you're coming from, your context, and even the person who's working with you, a psychologist or a psychiatrist, if they are responding to you and, correcting your perceptions. Oh no, that's not cultural genocide. No, it's unfortunate, but it wasn't cultural. That doesn't help the person in the room who's trying to deal with that trauma. And I think even the professions like psychology and psychiatry have become more aware of what they're doing, systemically in this time, and because of the discussion about, emotional safety. I think it's wonderful.
Yeah. Does anybody else want to add their comments?
Yeah, I just wanted to say, from a care provider perspective with the pandemic, and what I hope stays is that, and Leslie touched on this too, is that digital care and the virtual care that we have seen to be effective. And I've found just in the clinical world that it's helped to reduce barriers to access treatment, reaching people where they are at home, for ongoing care, and helped with attendance. It's helped get people into groups. Like I've had some patients that would never step foot in a group with other people, but with the luxury of Zoom and being able to step away and then step back, and it's sort of been an exposure exercise, and a wonderful one, because it's engage them in treatment where they wouldn't have otherwise engaged. And so I hope that's something that we can continue to offer as we move forward.
Thank you. Corey?
Yeah, I love all these comments. It's so amazing. And it's important again that we stay client-centered. We've been really good about learning how to do that, but now we've really got to do that going forward, and hear their stories. And as mental health professionals, what do we do with that story? Where's the pain? Where's the what do they need? Listen to that client. We tend to traditionally, at least within my group, we're putting people in these lovely boxes of diagnosis and things like that, but we're not moving beyond that. We're not listening sometimes to what they're saying. And I think we need to really make sure we carry that with us, that we're staying client-centered, listening to those voices. And then, coming up, we have some beautiful minds in this room, coming up with ways to help that healing, right? And I think we can now do that because COVID was really good about bringing us together versus before we met once a year or whatnot. But now we're more together as a community. And I think we got to use that and keep using it, not to lose it.
I think he's speaking your language, Vincent. Community, that's something you and I talked a lot about.
No, absolutely. And I'll really echo all the comments that's been made. I mean, if it had not been COVID, government of Alberta, for example, had been reluctant to provide billing codes for physicians to be able to see patients virtually via Zoom and other means. But because of COVID, they've made it possible, and not just made it possible, they say it's permanent. So it definitely signals a shift in policy from the government of Alberta in terms of realizing that this is not just for the pandemic situation. And it's, as Mo indicated, it's helped reduce no-show rates. A patient doesn't show for your clinic, in 5 minutes you call them, oh, I forgot about my appointment. Well, I have the next hour. Are you able to talk about your problems? Yeah. So that's really revolutionized, the options and opportunities for people to be able to have ongoing care and reduced healthcare costs as well.
Wow. Candace, I know you've really evolved in terms of the work that you've been doing since COVID began. How do you think things are going to change? What do you think is going to come out of this going forward?
Well, it's not so much a think anymore, it's a gonna happen, Leslie. So, you know, the collaborations that we are speaking of, referring back to the first panel of this series where we had the senior leaders get together, you know, and we have people like Mark from Glenrose Foundation poignantly just say, you know, it doesn't take a lot. Give your time, give your kindness, give your time, etc. Right? So really my hope moving forward is that, again, with a more trauma-informed lens, with more tolerance and understanding, that's what we can do, is open up our time, if we have it, and open up our hearts a little bit more. So I know for myself, since COVID hit, I'm supporting people, you know, outside of work, on average 6 to 12 individuals per week that are calling, again, with just problems, as Dr. Vincent said, right? And I just find that if I have the time and I can offer that gift to them, it's very helpful. And we know that evidence, we've already talked about it. Evidence says that, right? So that peer support approach, again, is something that we've been passionate about at CASA, and they have their parent in residence program. And that's what it's all about, is parents or caregivers helping other parents and caregivers.
Yeah, I should mention that's one of the things that I've always been impressed about CASA, where they said, you know, some parents had some issues with what was happening at CASA, and the CEO said, okay then, you know, put together an advisory group and advise us on how to do things better. And the same thing with youth. And it's such a beautiful model. It works so well. Marcia, did you have anything you wanted to say before we move on?
I know that COVID has helped us to see where we can make changes in our lives. And one of those things is, I think we are forced to examine our own internal dialogues and the scripts that we have written about ourselves and the way things should work, and let go of some of those scripts and write new ones that serve us better, that strengthen us. And we can also encourage our clients to do the same.
Wow. Nadine, you could make a comment or move on to the next question.
I think I will move on, Leslie. Next, we have Lenore from Drayton Valley.
Yeah.
So as a high school counselor, Lenore has shared that a majority of students who have previously struggled in school had school resources to help them with their struggles. Her question is, how do we support our students' emotional and motivational struggles when learning in a bedroom, which is not a productive learning environment, while educators ignore and dismiss this very real struggle because their outcomes for teaching do not include mental health? Good question.
Okay, so I'd say Alex or Marcia should start with this one.
I guess in terms of how can we support young people further, I mean, one of the things I would do is, I guess, turn to my youth engagement roots and engage the students or the young people as to exactly what kind of support they are needing, or what kind of services from school that they're missing the most, and how can we adapt that to the virtual world. That's probably what I would turn to. Oftentimes young people are not consulted, and when people are trying to figure out what to do to support them or provide services to them, and then we end up making stuff that doesn't really work out for them. And so the first step, I think, would be to actually speak to the students at hand, basically.
Vincent? Yeah.
I think it would be useful to kind of increase the level of family awareness about mental health issues. Usually people go to educational institutions and really learn a lot, but there's a lot they can learn even better from the home environment as well. So if we're able to educate parents about mental health issues, then it probably will translate into better education for children and the youth as well. More often than not, we tend to rely a lot on our educational systems to do all the work. And if we're able to begin from the roots, it's just like passing on culture and tradition, to the next generation. Then at least they will have some basis upon which they can be able to build. There's definitely some formal teaching about mental issues going on in the schools, but more than not, because there's not really a very firm foundation from the home environment, it makes it very difficult for the kids to be able to grasp all of it. So I'll be more of an advocate for, let's begin from the home environment. Let's educate in our workplaces, the adults. Let's educate, parents in various groups, that they attend, and they will definitely translate that knowledge onto the youth and children at home.
Beverly, have you seen a lot of this in your practice?
Yes, I don't just work with Indigenous youth, and I found that with the pandemic, children are not operating in isolation, even though it looks like it when they're in the bedroom, like you said, but they're in a context of a family, they're in a family system. And I think if we support the parents, we realize they're grieving many losses. They're grieving loss of identity. Some of them used to go into an office and be a supervisor, and people would jump when they asked them to do something, or, they had some idea of, they expressed themselves through their work. So they're grieving that loss. They're grieving identity loss. They're not kind of sure who they are because they put years into becoming who they were in an office, and they're grieving loss of control. There's so much of the news it's a bouncing ball. It's not the fault of the media or the government, but it's a very fast changing situation. So any parent, especially one who likes things to be neat and in control, is really panicking right now. So I think supporting the parents and just seeing how they're feeling about, maybe it's not education they need to talk to the kids about. It's like Vincent said, it's about learning. It's not just one person standing in the front of a room and telling you information. They can learn within the context of their family. Now's maybe a good time to get out your piece of paper and look at your family tree and your family history and many, many things about your culture, or go outside and connect with in Indigenous world, we're related to all the plants, we're related to the animals, we're related to the birds. Like, we might not be able to see grandma or grandpa or a classmate or an auntie, but all our other relatives are out there, and they've been just waiting for us, just waiting for spring. So we'll come out and see them again and get to know them. So that's one of my ideas about learning. Thank you.
Wow. I bet a lot of her remarks were really resonating with you, Candace, with all the different family situations that you've seen.
Yeah, absolutely.
Yeah.
Absolutely. It's such an exciting conversation again. You guys probably just see me just grinning the whole time here on screen. It's all about supporting the caregiver. Yeah, whether that's frontline, like we've spoken about, whether that's a parent at home, the caregiver needs our support. And however that looks, if that's, a friendly hi, like Corey mentioned, right? Walking down the street, you just take a couple seconds to say hi to someone, or maybe you share your story of your strife or your challenges. But however that looks, we need to get into a place, where we are honoring, respecting, and lifting up family.
Mm-hmm.
Corey again mentioned he's creating spaces of family at his place of work. This is a necessity. If it wasn't important, why would we be doing it?
Mm-hmm.
Family first, right? Family first. That's my passion.
Does anybody else want to add before we move on? Suzette, Corey, anyone? Okay.
I think for me, just thinking about the importance of family, they're often the backbone of so much, the backbone of our healthcare workers, of our teachers, of our society, of our military, of our public safety personnel, our veterans, our every community that we have, and often the unsung heroes that that support those who are doing so much in the face of society. And so I think there's so much that needs to be done to support our families. And I really, really appreciate the approach of empowerment and gratitude and supporting the parents so that they can actually be strong, be themselves, reach their potential, and be able to model resilience to their kids. I think that's a beautiful way of being able to turn the tide on some of the intergenerational challenges that we've seen in Fort McMurray and other contexts that we've spoken about today, even what's on the news right now. And that there's so much that can change by the way of each one of us being able, not just individually, but collectively, being able within our organizations, within our family units, and otherwise to be resilient and hardy, whatever resilience means, but being hardy and being able to stand in the struggle, to be with one another, to be connected, and to be able to really model what connection is, model what communication is, what voice is, what empowerment is, what taking a breath is, and being able to stand steady and sometimes struggle and suffer and cry and know that it's okay to go there too. And to stand in the hope. So all of those awesome things that happen in the family unit where we learn to be with one another, learn to be connected, the importance of attachment and that sense of just knowing that I'm sure about you. I'm sure that you're there for me. I'm sure that our community is here for us and that we're okay and safe in that safe, trusted environment and place, those safe spaces. So there's something about that. The beauty of the family unit in its wholeness and also in its fracturedness and in all that families are, in the complexity of it, to be able to be the building blocks of our society, where stories are held, where storying happens, and where our collective happens. So it's profoundly important.
So just to throw something out there, not everyone has families, right? That can come together and be there for them. There are kids who get kicked out for various reasons, parents who can't cope. Being in a family environment during the pandemic, I know can be very stressful because people don't have their space. So, and they don't have school anymore. To come back to that question, they don't have those kinds of resources that they would get, or someone who can look and see that they're in trouble and do something about it. What about those scenarios?
I think that's a really, really, really important point, Leslie. Thank you for naming it. I think that not everybody has a family. Not everybody comes from a family that is supportive. And some families are struggling more than others, definitely.
And Marcia, you see, I'm sorry. My body language is all off.
Your body language is
Zoom. So, because Marcia, I know you see those kids. You see the homeless kids. You see the kids who don't get the support at home. And they're not getting the supports from school. So, what advice can you give?
So in our case, it's the staff who stand in for families most of the times because our youth, they're homeless. Many of them are kicked out from their homes because of conflicts at home, or they're being abused at home, and so they are on their own. So we try to have conversations with the youth regarding school, for them to talk about the challenges that they have with virtual learning. We try to collaborate with them in finding solutions for the problems that they're having. We also try to help them to make connections, because they are missing the connection. So we have to try to help them to find ways in which they can make connections and ways in which they can attach safely, so that they can carry on with school and pay attention to their mental health. At the same time, we also try to engage them in activities like mindfulness and grounding, which helps anxiety and helps the issues that they are having at this time. So it's staff who really have to step in and do all the work that the family would do.
Corey, I think I saw you raise your hand.
Yeah, I know. Marcia just said everything I wanted to say. It was really good. But it's also just really reminding these kiddos that they're not alone. Yeah, you don't have your school, you don't have your basketball team, you don't have your drama, you don't have debate, you can't hang out at lunchtime with all your friends and be cool. but there's different ways to do that. And I think we just now need to kind of find those ways to bring that coolness back into things. But I know for a lot of our folk, they don't have a family. And so, yeah, we have to create that in some way that works. And it really started by listening to what the youth needed again. And I can't say that enough, listening to what they needed. And if they said, today, I just want to have my nails painted and we're going to watch Disney films, that's what we did at the center that day, and stuff like that. If it's, I just want to sleep on your couch, Corey, in your office, and if you could stay in the office so I feel safe, that's what we're going to do. It's finding different ways to exactly redefine what family is and to create that sense of belonging and that they're loved as well. Yeah, for sure.
Wow. Mohit, there is room for you in this conversation too, because, we talked about opioids and wine and that kind of thing, but there are lots of different forms of addiction. Lots of kids who are glued to their video games. There are other kinds of things too, and I don't know who's paying attention or what kind of help that they can get, but it goes back to that question that Nadine had, talking about if they don't have those resources from school, who do they turn to? What are the options available if a kid is really struggling with some form of addiction?
Yeah, I think, a lot of what the panel has highlighted is really applicable to addiction. We know that, children and youth that struggle with those adverse childhood experiences, it's really important to understand what those risk factors are for them and try to support them there. And so part of that is really having that conversation, understanding that what might be helpful for one person may not be useful for another person. And so I think being individualistic in that process, being as low barrier as we can be, introducing positive supports, peer support or addiction counselor or someone that they feel comfortable connecting with, making sure that there's flexibility, right? And sort of having them access care or completing school, in the hours and the curriculum, all of these things are really important when you're looking at someone and trying to meet them where they are at in terms of their substance use or whatever help that they need.
Vincent, does Access 24/7 pertain to any of this?
Yes, certainly. Access 24/7, as I indicated, anybody can call any hour of the day or any hour of the night. So, people find themselves lonely and alone or having any very dark thoughts. We do have our stabilization team that can step in to provide support. There are social workers on the team that assess any social needs that the individual may have. There's often connections to other community agencies, for people. So really, there's help out there. And as you indicated at the beginning, sometimes people are not aware of these resources that are available to them.
Mm-hmm. Nadine, do you want to continue on with the next question?
Sure. This next question is from Cindy in Fort McMurray. There are different pandemic concerns relating suicide, self-harm, and a significant increase in emotional, physical, and sexual abuse within homes. How do we provide care as mental health professionals when the politicians and media are not focusing on these as major concerns?
Okay, who wants to be in? Yeah, go ahead, Suzette. Yes, go ahead.
I know that the need for people to isolate, to stay in place, like you said, has made it very difficult. Housing is already an issue in the Indigenous community. Overcrowding is an issue, and not having the luxury of another place to go if you are in fact tested positive and you need to recover somewhere else. And the other thing that is happening is what was mentioned is that, yeah, if there has been any kind of conflict, or if you're living in a family where multiple members are being triggered by what's going on, and also like increased violence, increased lateral violence is taking place behind the closed doors, because everyone's trying to balance this out, right? Safety, a different kind of safety, a health safety with mental health safety. So It is. It is a time when it's really good, I think, to talk to people about like trauma, compassion, so that they themselves can somehow be okay with themselves and cut themselves some slack. And we know quite often someone who has been who has acted out aggressively, violently, will often tell you just before they struck someone, the feeling they had was hopeless and helpless, and anger and at themselves for the situation they're in. So I think being able to talk to people about, self-compassion and can help some of that. It doesn't get them out of the house. I know that. I apologize. I'm not trying to diminish the harm, but I think we can help those who are still in their hearts and their spirits with what's going on with them that's, causing them to behave in certain ways.
I mean, a lot of this stuff you can't measure, or there are a lot of studies that say that there's an increase, but everyone is alone. Everyone is dealing with their own individual thing, and it's hard to know how prevalent it is. Is that an accurate statement? Is that accurate from your experience?
I think that what we were seeing, beforehand, the conditions, the variables that existed beforehand in different groups, maybe new Canadian groups or, the LGBTQ community, people, don't forget there could be lateral violence there between partners. And in a way, COVID has kind of like deepened some of these issues like poverty and some of these other issues. So I think it's safe to say there is probably an increased frequency in the numbers, of incidents.
Vincent?
I think it will be difficult to know really what the prevalence rates are, but certainly we are getting more and more visits to our Access 24/7 facility in respect of people who are distressed because of marital and family conflicts. There's definitely a dramatic increase in those who are presenting and being assessed at our urgent psychiatric clinic, but it's not possible to really know what the percentage is. I think a study will certainly be useful to give us some accurate numbers.
Mm-hmm. Anyone else before we move on?
Yeah, I was just thinking, I don't know the numbers, so I don't want to speak to the statistics, but certainly we know that when there's stress, stress comes out in so many different ways in anyone's life, let alone within a family unit. And if there's going to be vulnerabilities, that when those stresses are high, and as we've heard from others talk about, family loss, financial loss, people losing their identities, people losing their relationships and their homes and their jobs and their businesses and all those things, that those pressures are going to come out in many ways, and challenges that people struggle with or ways that they cope will come out in different ways. So it makes sense that those numbers would be elevated. What the statistics are, I don't know. I know that there are efforts underway to try and ascertain that, but I'm not one of those that has been fortunately looking at those numbers.
I think this is a really good opportunity to talk about resiliency.
I do too.
And hopefulness, and this is not toxic positivity, Candace, but it's about what is it that makes someone resilient and hopeful, what are those factors, and what can we learn from them? How can we help people who really struggle with that?
I wonder if some of the change is not that toxic positivity, but that just encouragement to turn toward, to turn away from those things that are not healthy, those empowering people, strengthening them to make good, healthy choices, or to look at what they're really feeling and what really is that emotion, that powerlessness or that helplessness that happens before someone makes a choice or acts out in a particular way. So it's that helping people understand what's driving some of the behavior, what's driving things, and helping them to be empowered with self-awareness and with skills, and not just themselves, but because I don't know that resilience is just about me or we, or like it's not just about us individually, it's about us collectively as well. that you can take any one of us who might be as resilient as we possibly can be, the superhero resilient person, but that certain, you can put that superhero into a toxic environment, and any one of us would potentially not be able to withstand that that kind of an environment. So I think we need to think about it from an individual and a social and a collective kind of a way as well. So that ability to be able to be authentic, be real, be compassionate with ourselves, with one another, be connected, talk. You brought forward the importance of talking. Just to circle back to the connection and communication and talking, the compassion, the walking towards, the turning towards, the bridging the gaps, the reaching a helping hand out to another, the making a choice to be compassionate, to be loving with one another, and to make a difference.
I certainly feel a lot of the love in this group and how important that is, because it changes. It's changed my mood since we've begun. Not that I was in a bad mood before we began, but I certainly feel having this conversation very hopeful, and I feel a lot of love in this group, and that I seem to see that without the word being used, being a bit of a theme for what we're talking about.
I think that compassion and the altruism and the care, the seeing, the knowing, the hearing, the taking time to listen, to stand with another, just to be with one another in the struggle, in the joy, in the real, in the pain, in the kids' bedroom, where they're doing whatever they need to do in order to try and maybe advance in their schoolwork. Just to be with, that there's something about that enables that changes us. And helps us all heal and deal with the stress at the time. I'll pass it on.
That's beautifully said. Thank you very much, Suzette. Before we move on, we've got we've only got time for one more question. Do you want to go on with that, Nadine? We just have time for one more.
That was actually one of the questions, was if my child is feeling hopeless, what are some strategies to promote hopefulness? So that was actually just one that came into us. So
nice.
We've talked about that already. I do have one more from an anonymous in Edmonton. Mm-hmm. I am a middle-aged lady of the double-decker sandwich generation, which means multiple layers of caregiving. What can I do about memory issues, poor concentration, anger, depression? I also work in healthcare. Antidepressants don't help, and online talk therapy has not been helpful. What can I do?
Wow. Vincent?
Yeah, so with any mental health condition, we manage according to what we call the biopsychosocial model. The bio has to do with the neurochemicals in the brain and trying to balance them out. So that's where the antidepressants come in. Then we have the psychological. There may be some stresses that may be going on. It often connects with the social, where probably there are some family stresses, marital disputes, employment issues, work stresses. So I think it would be useful to examine the particular individual and try to see if there are any particular identifiable stresses that need to be resolved. For example, if you are living, with a family with conflict all the time, no antidepressant is going to be able to resolve the particular depression that she may be going through. It may be a case that there may be a need for family therapy to resolve the particular conflict. Sometimes people's mental symptoms also arise from physical health conditions. Things like, for example, thyroid problems or low iron levels could very well manifest as depressive symptoms. So you may be treating something that you should be treating physically with more mental health drugs, and therefore they are not going to work. So I think it would be useful for her to go to a family doctor and discuss probably potentially getting a referral or even calling our Access 24/7 helpline, walking in there and requesting for a full psychiatric evaluation to determine what may be most suitable for her.
Ask for help.
I can add another layer to that. I think too, I've heard so much about people's identity or their loss and a sense of loss of meaning and purpose too, and just connection. And so with the biopsychosocial approach, there's also the spiritual kind of a connection or a domain of meaning and purpose and identity and connection and all of those things that kind of weave in sometimes with the biopsychosocial or get lost. And sometimes when people have a loss of sense of meaning, don't have an anchor anymore or a compass, they can turn away from rather than toward themselves and toward life and towards meaning and purpose. And that can people can have a sense of loss of what's meaningful for them, and often underneath that depression or the anger, or even sometimes under the suicidal thoughts, can be something conflicting with our values, that something isn't going right, and that the things that really matter to us, we've lost, or they're compromised, or we haven't been able to live them out. And so we've lost our sense of meaning and our purpose. And that goes back to the first question you asked me about that moral injury that we're seeing in people right now, where maybe that value-driven behavior, maybe those things that drive us towards what gives us meaning and connection, be that family or be that purpose or whatever it might be, that some people are losing that right now, or have lost it or have never found it. And so helping people have that sense can also, from that domain, be something to explore, to amidst all of the other things that Vincent has flagged and others have flagged.
Insightful. I think we've run out of time. So what I'd like to do now is I'd like to go around to every member of the group and get final words, because I'm sure there are lots of things you've been thinking about that you haven't had a chance to say during this conversation. And I thought, Marcia, we'd start with you.
Okay. Well, I do want to talk, my final word to be on resiliency. And in our case at the homeless shelter, we try to help youth explore and build protective factors so it can increase their resiliency. It can help them to withstand whatever is they may have to face in the future. And sometimes it's about helping youth to explore hobbies or teaching them skills so that they can establish and maintain relationships, things like that we engage in to help youth to build their protective factors so that they can be more resilient for the future.
Well said. Mohit, would you like to have the final word next?
Yeah, thanks so much. Yeah, just reflecting on a lot of the great comments being made. And I think the underlying theme for me is, please reach out, and with that resiliency, keep hopeful. And I've seen a lot of people come through our doors that are in all sorts of past different stages of illness, and be able to change and get to their goals. And I think it's important to know that there's people like the wonderful people here on this panel that want to engage and that want to be able to support you.
Candace?
Do we have to end, Leslie?
I know, I don't want to end.
There's so much, my pen is just on fire here, but I guess just to recap a few things, in terms of what resiliency means for myself professionally and with lived experience within my family. 2 words, it means failing forward, and not being afraid of that. And it's taken me a lot of years to embrace that and to be at a place where I can now look at crises or the events that we went through and pull out the positive, as odd as that sounds, right? Pull out that resiliency. And then with matters of hope, years and years ago, I did programming in Parkland schools for Roots of Empathy, an anti-bullying program. And it was a grade 3 classroom that gave me this acronym for hope. And I've used it for years because it turns hope into a verb, an action word, Corey. And that is helping other people every day, right? So succinctly, again, community matters. families, not traditional anymore, guys, all shapes and sizes. And every child and youth, they need one healthy adult, one. And they are off to a great start. So we got this.
Boy, Corey, I think that's your cue.
I wish we didn't have to end either.
I know.
I think as providers, we have to stay together. We have to learn to do this wraparound support like we're doing. Shouldn't be in these silos. We're from different agencies, different organizations, but we need to provide people a wraparound kind of holistic approach to support. We can work together like we are now. And I'm sure this conversation has inspired a lot more connections afterwards to help our folk. And so that's my challenge, is let's keep working together to provide that wraparound support. For those of us humans that are living on this little island, Turtle Island, you know what? Learn to find that little bit of hope. It doesn't have to be finding a new job tomorrow. It doesn't have to be, these big things. Learn to enjoy that cup of coffee in the morning. Learn to enjoy the wind on your face as you're out for a walk finally, because you don't have to stay at home. Learn to celebrate that song on the radio. Don't always look at what you're missing. See what's right here in front of you and celebrate that. Bring it in, take that in, because there's the hope you might need to get through the day, to maybe say, I'm going to go grocery shopping today, or I'm going to, whatever it takes. There's little bits of hope. We need to change the lens. Don't always see the beyond. Just see what you got in your life. That's hope. There's things there. I bet you can find it. You just got to look.
Wow, Alex, you're beaming.
I absolutely love that message, Corey. Thank you so much. I guess on the topic of resiliency, I wanted to once again drive home that youth engagement is not a fluff piece or an afterthought or a PR move. It really is so important to young people. It's been shown to reduce risk of suicidal ideation in youth and promote higher levels of resiliency and connectedness. Not only does youth engagement and really meaningfully including them in your various processes, not only does it help the young people who are part of the process, but the youth who are going to access the services after. Young people, I know all of you know this, but we deserve good mental health services. We deserve good health services. And in my experience, the only way we're going to get them is if we're actually included in the process of making them. And I think that is a pretty surefire way to build resiliency in our young people. And so I just want to give a quick example of that. And also for those who are looking for a little bit of hope. So Kickstand actually partnered with Dr. Agyapong, with Vincent, to create More Good Days, which is the youth version of Text for Hope. And so any young person with a cell phone can text the word More Good Days to 393939, and they will get the first phase, which is 90 messages that were originally written by Vincent's team and now have been adapted by young people for young people. And there's more to come. So I think that's at least a good first step towards that hope that we're looking for.
What a brilliant idea. Talking to you, Vincent, I get excited, and I think, what's he going to create next? Please, final words.
Yeah, so there are a number of self-help things people can be able to do to support their own mental health and resiliency, as well as that of the community. Certainly finding time to exercise. The gyms are all closed, but YouTube is not closed. Your instructor is on YouTube. You can very much exercise in your home as well. There are so many different exercises you can do. The other thing is certainly ensuring that you eat healthy. Eating healthy protects both your physical and your psychological well-being. Other things people can be able to do, certainly finding something to be grateful for on a daily basis. Gratitude is actually very much evidence-based, improves mental health and well-being of individuals. There are randomized controlled trials which are validated this as a very useful way that people can help themselves. You don't have everything you need, but you certainly have something that other people want. So find that thing that you have that other people certainly want and be grateful for that. You can also certainly practice random acts of kindness. This is also very much evidence-based. People who practice random acts of kindness have better psychological well-being for themselves, as well as the people who benefit from the random acts of kindness that they receive. And if things are going difficult for you, certainly reach out for help. Our Access 24/7 line is open 24/7, 7 days a week. We are there to support you. Nobody should feel isolated. Call and we'll have our team support you.
Wow, thank you so much. Beverly, final words.
I liked, Salam Alex, I like what you said about reaching out to other people who have the solutions or know what it's like to be in those moccasins and know how it feels. And so my advice to many caregivers and many mental health providers is to look for strength-based interventions and responses in the Indigenous community. There are so many. You know, my parents died when I was 7. And so I was raised by 7 aunties and uncles in my community. So I had, and more than that, one person, you know, attachment was so important. And they taught me in our own language, in our own ways, so much how we're never alone. We're always independent with other spirits, with other souls. And we're never just alone like some science experiment where there's one little cell all by itself, you know, underneath a microscope. So I think resilience, it came to me because I knew I was connected to 7 generations behind me in the past, and I'm connected to 7 generations in the future. So those kind of stories somebody had mentioned earlier, those strength-based approaches, they exist in all our cultures, and I invite people to look.
Beautiful. Thank you, Beverly. I guess last word goes to you, Cosette. Suzette. Where did Cosette come from? Sorry.
I think that's from a musical. It's just beautiful hearing, you know, the different kinds of ways to build resilience. It's almost like everyone needs their resilience toolkit to go forward, and so many of the different tools that people have named to go into that metaphorical toolkit, you know, that's there wrapped around with this attachment and connection. And I think the other piece is, you know, salt and peppered with compassion and love and care and being with. And I guess the final, you know, going to Corey, what Corey said, you know, that almost taking a shift in the lens and celebrating what's right, looking at those little moments that are so essential. And I think from my sister, a word was the great turning toward. And I really love that, you know, that the great turning toward each other, the great turning towards ourselves with an authentic look, the great turning toward healthy attachments, the great turning toward true positivity and true gratitude and true connection and authenticity, and really celebrating what's right and looking at and looking out and reaching out to others when we need help. And every one of us needs help at one point in time, if not multiple times in every one of our lives. So knowing that all of us have a shared common humanity of joy and struggle and being, and that there's a storying of our whole connected humanity that is so rich and so beautiful, and that there's something to celebrate in what's happening right now, and profound hope around us as we look forward to, you know, a new day of breaking down further the stigma around mental health and opening up the conversation so that we can be truly connected, we can be truly together, and stronger together for it. So,
Wow. You know, the vision for this part 2 was to do a virtual town hall. Can you imagine the power if we had this group where we were all in a room together, and the connection that we could build with the audience, and the power of something like that? So we just may be calling you back. We've done it virtually. Let's do it live. I just want to thank you so much. What a fantastic group. I was so excited after speaking with each of you. You're all gifted, and you've gifted us today. So thank you so much, Dr. Vincent, Agyapong, Suzette, Bremault-Phillips, Candace Fair, Marcia East, Alex San Diego, Beverly, Keeshig-Soonias, Mohit Singh, and Corey Wieness. Thank you so much. This live stream event has been recorded and a link's going to be posted on the CASA website. That's casaservices.org/web/series. And all the other webcasts that we've done are going to be at that location as well. In the meantime, Mark Corthius, a CEO of the Glenrose Foundation, Rehabilitation Foundation, and a partner in our mental health, appeared on Global Morning News today with an overview of this new mental health collaboration and details behind the web series. So you can catch a recording of that interview at globalnews.ca under the videos section. And coming up next month, part 3 of our 3-part series on mental health, 1 year in. In this webcast, we'll be talking about where do we go from here. We'll hear from international and national thought leaders and innovators about what's been tried and what's working. And finally, what did you think of this live stream and any of our other webcasts? We'd love to hear your thoughts and any suggestions you might have for future webcasts. Just click on the link in the description below to fill in a short survey. On behalf of CASA, yes, the Glenrose and Kickstand, thank you for joining us. I'm Leslie McDonald. Be well and be kind.